Welcome to Money Secrets with Bill and Mike.
I'm Bill Alexander.
And I'm Mike Tove. You know, Bill, I don't know if you know this, but I started my financial career a long time ago in medical insurance, and that has certainly changed a lot over the last few years, hasn't it?
It sure has. Not only has insurance changed, but medical care has changed so much in the last 30 years. It's so different.
And you know, and of course the biggest series of questions that I get all the time is people worrying about, well, what's going to happen when I reach 65 and I have to go on Medicare, and is that going to be there? What are they going to do? People tell me, oh, I'm not going to be able to afford it. It's going to cost me a fortune.
Well, you know, one of the things about Medicare is that it's a lot more complex than people think. There's so many moving parts with Medicare in terms of when you sign up, what do you sign up for, whether you have to revisit it or not. And you know, the mistake is so many people think, oh, you just sign up and forget it.
Right.
And not true at all. In fact, one of the things I've said for years is the fact that seniors' lives are much more complicated than when they're working. I mean, it's silly, but the fact of the matter is that seniors have to look at all of these financial issues that affect them in big ways and make decisions every year.
Yes.
So I'm really pleased this morning to have an expert on Medicare, because that's important to all of us.
Well, Warren Coble has been with us before. And
He has. He's the Social Security guru, but he's also a Medicare guru.
Yes. And so when we come back, we're going to have a conversation with Warren, and let's see what we can come to. Welcome back. All right, Bill, so we have Warren Coble with us again today.
My good friend Warren's back with us, and we're delighted to have you, Warren. I think our audience already knows that you are the Social Security expert, but so many folks don't realize that Warren Coble is also a Medicare guru. And the fact of the matter is that Medicare is pretty complex. I know that enrollment is a huge issue in terms of, well, I should say, age 65 is a big number. We can no longer deny that we're seniors at that age. So, well, the bottom line is, tell us about 65 and why it matters.
The reason that 65 is so important is that is where the initial enrollment period for Medicare begins. You basically have 3 months before 65, the month of, and 3 months after. That's known as your initial enrollment period. The reason that it's so critical, Bill and Mike, is that if you fail to enroll timely when you should, you can be locked out of the system for months, possibly, and charged penalties once you're allowed back into the system.
What kind of financial penalty is involved if I fail to sign up within that 7-month initial enrollment period?
It's a 10% annual penalty for each 12 months that you did not have Medicare but needed it, and that is a lifetime penalty. A lot of folks think, oh, I'll suffer the penalty for 2 years and then it'll go away. It is a lifetime penalty.
So if I'm still working at 65 and I should have enrolled, but I mistakenly don't enroll for 2 years, that means I have a 20% penalty?
You are potentially facing a 20% penalty. And that, I think, Bill, that's where it gets so tricky, is depending on the type of employer coverage that an individual has, depending on what that coverage consists of, determines whether or not that individual needs to file for Medicare or not. And I can give a couple of quick examples of that.
Please do. That's
one of the prime examples is if you've got an employer plan and you have less than 20 employees on the plan, or less than 20 employees employed by the company, then generally that person needs to go to Medicare. Conversely, on that, if you have more than 20 employees in the company, not on the insurance, but in the company, then generally you can delay without penalty and you get a special enrollment period when you leave work. But then it's very important that you pay attention to that enrollment period, which we'll probably get to in a few minutes.
What about with spouses? And for example, I'm covered under my wife's plan, but I am a business owner, so I don't have an employer covering me for coverage. So when I turn 65, which is next year, oh God.
Welcome to my club, Mike.
Thank you. And how does that work with my coverage being under a spouse's plan?
It's fine.
For a large corporation.
For a large corporation, you could continue the employer coverage. Now, one thing that we encourage individuals to do, again, as we always do with Warren Coble Associates, is check out your options. Don't just assume that everything is going to be hunky-dory and work like it has before, because 65 is that major magical number. And we encourage folks, look at the premium that your wife is paying.
Right.
If she's paying $700 or $800 a month to cover you, my goodness, we can get you a great Medicare plan for less than $300, $400 a month with great coverage. But on the other hand, if your premium is reasonable on the employer plan, if the deductibles are reasonable, the copays are good, then by all means stay with it and don't enroll in Medicare.
Well, it sounds to me like we need the advice within that 3-month period before we turn 65 so that we'll know what we should do. What if I've been fired and I'm on COBRA? In other words, I'm still on my employer plan, but I'm having to pay for it personally.
COBRA does not protect you for a special enrollment period. So as soon, it is very important, because again, if you don't get that coverage at the proper time, you can be locked out of the system.
So if I miss my 7-month window, and so I'm 4 months past my 65th birthday and I haven't enrolled, I have a 10% lifetime penalty at that point.
You're going to have that, yes, sir, because what will happen, let's just say your birthday is January and your 3rd month then is going to be by the end of April, and you don't enroll, your next opportunity comes around the following January to sign up. But guess what? Just because you sign up in January doesn't mean you get your coverage. Your coverage doesn't begin until the following July.
Ooh.
So you have at
So
least
we're
a 12
uninsured.
months. So you're uninsured, and if you have a health claim, guess what? It's your nickel.
Right.
Now, I do need to point out that is for Part B, the medical insurance that covers outpatient care.
Isn't there a penalty if you don't sign up for Part D?
Oh, yes, sir. There is also a severe penalty for that one as well.
How does that work?
That one, you also have the same initial enrollment period. Then you have an annual enrollment period for Part D every fall, October 15 to December 7th. The failure to sign up for that, the penalty is 1% for each month that you could have had the coverage that you didn't. So right now, the penalty on those is about $47 a month.
Let's take a moment and just back up. For those that are not familiar, just kind of review the alphabet soup.
Sure. Okay. Medicare has an alphabet soup, A, B, C, D. And I usually jokingly tell folks that's see how easy Medicare is. Anybody can understand Medicare. It's A, B, C, D. A is hospital, generally inpatient coverage and skilled nursing care for rehab purposes.
Now that's the part that we've already paid for.
You've already paid for that.
That
You pay
is not
1%.
100% of coverage, though, is it?
No, it's not. You have, in 2017, you're going to have a $1,316 deductible for up to 60 days of inpatient hospital care.
And 80% of...
And then 80% is on Part B.
Oh, that's right.
Part B is in boy, is the medical insurance. That covers your doctors, that covers your emergency room, it covers your outpatient coverage, it covers durable medical equipment, ambulance charges. The deductible on that this next year is $183 one time a year, and then you have a 20% copay.
Right.
Then beyond that, some individuals are like, I don't like the idea that I could owe 20% of a $50,000 bill. So they buy a supplement plan from one of the major insurance companies that will cover that.
And that's sometimes called a Medigap.
That's a Medigap. Medigap and supplement are the same thing. Then you go, we have A and B, then we go C, which we say is a combination of A and B. C is a Medicare Advantage plan offered by private insurance companies, and then D is the Medicare prescription drug coverage.
Well, Mike, we're going to have to take a break, so we'll be back in a minute.
And we're back. So, Warren, you know, in the break, we were talking a little bit more about Medicare Part C, Medicare Advantage. And this is a big choice thing that people have, and without fully appreciating. I mean, you got people out there that are just selling Medicare Advantage like crazy, as everybody should have it. And then there are people saying, no, everybody should have supplement. But neither is really true.
Correct. It needs to be based on what the individual needs. And I think, Mike, one of the major mistakes that individuals make is, I'm going to buy the same thing my wife or my husband has, or my sister told me I needed this plan. And I've seen folks change their coverage on that basis without understanding at all the implications to the individual. And everything is individually specific.
It's also county specific too,
Yes,
or
it is.
Medicare Advantage.
One of the things that, you know, since we're talking about Part C, that I want folks to understand is when they choose a Medicare Advantage plan, they're actually coming off of Medicare.
Right.
In other words, the traditional government Medicare
It goes
sponsored
behind
plan.
that Medicare goes behind the scenes.
In
They're
other
still
words,
legally entitled to it,
Right.
but they cannot use it because they're choosing to transfer their Medicare money to an insurance company for the liability for the medical
So they
costs.
basically have a private insurance plan at that
Absolutely.
point. And I think that's really important for folks to understand. But, and as I understand it, it also makes a big difference where you live as to whether a Medicare Advantage plan might be a good choice or it could be an awful choice. Could
That
you
is right.
explain that?
The Medicare Advantage carriers, the insurance companies, pick and choose their markets. And of course, where are you going to market? You're going to market where you're going to make the most money and where Medicare is going to give you the highest reimbursement rates. So, and there are some counties where there are no Medicare Advantage plans available because they don't have the medical facilities there to meet Medicare's demand that you have to have this much specialty care available within a certain area, things of that nature. And then you have other areas where there are 20 choices for Medicare Advantage. And again, it begins to get so confusing to folks.
So basically, folks who live in rural areas have to be very, very careful.
Very careful, Bill.
In terms
Yes.
of whether they can get any care at all if they're on a Medicare Advantage plan.
Correct.
Well, the other thing is, and I have some experience with this, but even in the big cities, there are multiple Medicare plans, but they enter into marketing agreements with some of the hospitals, some of the providers, not all of them.
Correct.
And so you have a Medicare Advantage plan that covers Hospital A, but you want to go to Hospital B.
Well, and that can also be true for providers, for your physicians. So
Absolutely.
you want to make sure that your primary care physician, particularly if you've been to one for many years, that they're part of that.
Make sure they're in network, and that's the key. And another thing that we're running into now that we've not run into so much in the past is emergency room treatment. You think you're going to the emergency room and you're going to have a $75 copay, and all of a sudden you get a bill because the emergency room doctors are out of Texas. Their contract is out of Texas, so they're out of network. And so consequently, guess what? If you've got an HMO, a health maintenance organization plan, and you go out of network, it's all your nickel. You pay the whole bill.
Of course, the PPO plans have provisions for unscheduled or emergency care.
Now, all of the Advantage plans will cover you generally on an emergency basis, even emergency admissions, but that's the hospital. That's not for just the ER doctor.
When I turned 65, and of course y'all will enjoy this, not too many months away, but when I turned 65, I got all of this mail from pick this plan, pick that plan, and of course it was all slick marketing. What I have told folks that one of the few places that you can actually go to get objective comparison and analysis is through the SHIP program.
Correct.
Right.
SHIIP, it's with the Department of Insurance. And
Every state has one of those, Bill.
and that's what's so important is that is one place every senior should look to for at least their first blush analysis.
Absolutely.
And most states also have SHIP counselors as well, so you can get some free advice.
And it's non-biased advice. They're not there to push a particular company.
That, I think,
That's
is so important. But for me, seniors have to actually revisit their initial election every year, do they not? Tell me how that works.
They should, and that's the annual enrollment period, which happens October 15 to December 7th of each year. And during that period of time, an individual can change their Medicare Advantage plan or their Medicare Part D prescription drug coverage.
So if I'm on a Part C plan, a Medicare Advantage plan, do those plans change from year to year?
Oh, drastically, Bill. They can change their maximum out of pocket, they can change their premium, they can change the deductible, they can add a health deductible that's not been there before. And I'm amazed, even though this annual enrollment period, my staff contacted all of our clients to see how they wanted to change. Oh, I'll just keep what I've got. I don't feel like looking at anything. And we're like, but you're going to have a $295 drug deductible before it ever pays a dime, and you're going to have a maximum out of pocket of $6,700. There are plans available with a $3,400 maximum out of pocket. So not checking it out is the mistake.
So seniors can't be lazy about this.
They do not need
I
to be
mean,
lazy.
none of us want to have to revisit decisions on insurance.
It's frustrating, okay? But it's part of the way that the system works.
Okay, now we've talked about Part C. What about Part D?
Part D is Medicare prescription drug coverage. And the biggest mistake I think that folks make there is assuming, and again, I keep going back to the word assume, it creates major issues, but they assume because I'm not taking any medication, I don't need a prescription drug coverage
wanna
plan.
pay for that.
I don't want to pay for something I'm not going to use.
Boy, they're
but
gonna
you
pay
don't
for it
wait.
later, aren't they?
Yeah, they're going to be in for it later because guess what? All of a sudden you have a heart attack and you're on two $400 a month medications. That's going to be your nickel to pay if you didn't buy the Part D.
Now there's a penalty
And
if
there's
you
a
don't
penalty,
sign up.
1% per month for each month you could have had it.
Wow.
And that is a lifetime penalty as well that is
Plus,
never
you
waived.
can't just sign up anytime.
No.
You have to wait.
You have to wait until the annual enrollment period again. And so
That's pretty
folks
scary.
can really hurt themselves by not understanding these enrollment period requirements.
Now these Part D plans change from year to year
They
too,
change
don't
just
they?
like the Advantage plans do,
So
Bill.
again, we have to revisit it. Well,
Yes.
I know that
We'll be back and we'll pick up on this. And we're back. You get people just saying, oh, I'll just keep what I had. And
Yeah, and that's crazy. That's sticking your head in the sand. And
well,
you don't need
it's-
to do that.
It's a big financial issue
It is.
because it could cost you many thousands of dollars if you don't revisit it every year.
That's correct.
Or if you don't make the choice, or if you don't sign up when you're supposed to sign up. There's so many things about Medicare that scare the heck out of me. Where can I get additional information?
Okay, our website is warrencoble.com, WARRENCOBLE.com. We can be reached at 336-879-0848. And Medicare, the basic Medicare AB program is standardized nationwide. So we're able to guide individuals outside of North Carolina.
Are there any official websites we can go to?
Oh, absolutely. Medicare.gov is a great website. Also, visit the SHIP website. You mentioned SHIP, the Seniors Health Insurance Information Program. It's available in every state. Some states are better than others, but a lot of great information there as well. Just take your time, understand what it is. Is it Medicare A? Is it B? Is it C or D? Is it a supplement? Is it an Advantage plan? Or is it a prescription drug plan? And all of this myriad of information that you talked about getting, I jokingly tell folks, if you want new wallpaper, wait until you turn 65. It'll all say Medicare, but you can re-wallpaper your entire house off of the paper that you get in the mail.
Well, you know, at least in my law practice, where we do a lot of elder law, this is really complicated for seniors. They have to revisit it every year. So I would just put in a plug for anyone who has a senior that is getting confused, can't make their own decisions. This is where these are elections that the children really need to
They need
help
to step up to the plate.
their parents on, because it's not easy. And you need somebody at least that can give good advice. And the children can help an awful lot if they can look up the different plans, go on SHIP, go on Medicare.gov. That's so important.
We love working with a senior who brings that adult child with them as their ears, as their eyes.
Sure.
It's so important in every area.
Because so many times seniors, they've been bombarded with so much, and it just gets weary to
And they
them.
just say, oh, just give me one.
Well,
And that's the worst decision you
It's
can
also
make.
sometimes it's hard to distinguish between what's actually official correspondence from
Oh, that's
Social
true.
Security or what's garbage,
Oh,
mail from folks that are trying to sell you something. And so, getting good advice, again, we've said this frequently on this show, but getting the advice from the right sources. And obviously, starting with Medicare.gov and SHIP, SHIP, on the Department of Insurance website, those are great starting points.
So we'll be right back and we'll wrap it all up. So Bill, this has been such a fun topic for me because, as I said, I started off doing medical insurance, and I have done Medicare Advantage, and I have done traditional Medicare supplement, and to an extent sort of still do.
Well, to me, the money secret is that Medicare is more complicated than most folks realize. They're, just when to enroll, how to enroll, what to enroll in, and then having to revisit it every year because your plans change on you, and there's a lot of money involved. We were very lucky to have Warren Coble with us today, but doing the research every year, and if the senior doesn't want to do it, then the family needs to get involved to make sure those elections are done right.
And they need to get it from somebody who is going to be able to give them balanced, fair, impartial advice.
Absolutely.
So anyway, I'm Mike Tove. I own AIN Services. We are a full-service financial planning agency, and we can be reached at www.ain-services.com or 1-800-363-2296.
And I'm Bill Alexander with W.G. Alexander and Associates Attorneys, and we focus on estate planning, elder law, and asset protection. Please join me also on Saturday mornings at 11 a.m. on WPTF for Asset Protection Today.
And thanks for watching.